Hi, everyone. I'm Dr. Seth Meyers, clinical psychologist, and today I'm going to be talking about avoidant personality disorder. And I'm going to go a little deeper than I have in other videos to describe more specifically the sense of rejection and some of the self doubt and the self esteem issues that a lot of people with avoidant personality describe. So, we're just going to go ahead and get started. By the way, if you find this video helpful, please like this video so that it gives me a sense of what you find helpful. One of the things that I want to share in talking about avoidant personality disorder is that one of the most important psychologists really in history that we have had, Theodore Milan, spoke about avoidant personality, actually described avoidant personality disorder in very clear terms in his 1981 book on disorders of personality. And one of the main things that he talked about was that there is a longing that many individuals with avoidant personality have, a longing for connection. Now, a lot of times, people who don't have avoidant personality and are in some type of relationship with someone who has these issues, a lot of times they will tell themselves the person with avoidant personality just is cold or unfeeling or doesn't want closeness, pushes away closeness, that they are an island. They don't want any kind of connection. That's not who they are. That is not necessarily true. So, Theodore Milan, again, a psychologist who is celebrated with major awards and major acknowledgement from the American Psychological Association, the American Psychiatric Association, Theodore Milan talked about how there is this longing for connection, but, and here's what's important, that longing is interfered with by the person's own oversensitivity, the person's own self doubt, the person's own mistrust of others. For the individual with avoidant personality, it's really important to understand that connection and closeness and dependence on another person, getting too close, is really, really scary for fear that it may lead to rejection, it may lead to humiliation, it may lead to embarrassment. There is this excessive preoccupation about rejection. So, just as an example, let's imagine someone who doesn't have avoidant personality walking into a new social situation. Let's imagine them at a party and the idea of seeing someone across the room that looks interesting to them that they would like to go up to and talk to. For most people, when they don't know the person, they might feel a little nervous. They might feel a little bit anxious, especially if maybe they are romantically attracted in any way. The idea of putting themselves out there, sort of going out on a limb and asking, what's your name? And kind of expressing that there's interest there. That would make a lot of people feel a little nervous. A lot of people would feel a little bit afraid to be rejected, to put themselves out there, that they might feel silly or stupid. For an individual with avoidant personality, it's not about just being a little bit nervous about rejection. It is almost that a lot of people with avoidant personality feel so overwhelmed and uncomfortable that the mere thought of being rejected in that situation is anathema to them. It would be painful. It could feel almost impossible to walk up to that person. So, what I'm trying to describe here is that this is not your average rejection fears, just, occasional garden variety thoughts or self doubt about whether someone might not like them, what someone may think about them. This is about moments where someone with avoidant personality can actually feel terrified. Now, this isn't every individual with avoidant personality. And remember, too, that any disorder exists on a spectrum. So, a lot of people may have some characteristics of avoidant personality, but according to a mental health professional who assesses them, they may not meet the full criteria for the disorder. I want to talk a little bit more about the feelings that go along with that fear of rejection, that anticipating being humiliated in a situation, humiliated, humiliated. A lot of people, again, may feel nervous or anxious to put themselves out there, but humiliated, that is a whole different level. And that is what a lot of people with avoidant personality deal with. So, some of the additional feelings that go along with avoidant personalities who have this fear of rejection, this fear of humiliation, it is this sense of dread and shame that they can feel. So, one example, someone with avoidant personality, they may go to an event or be in a social situation with someone where they say and do things. Later or the next day, they may replay in their mind things that they did, things that they said, the specific things. They almost feel tortured by it, haunted by it. They can't stomach what happened, what they said, what they did. They feel mortified to some extent by this. So this is where some of the dread and the shame comes in. Again, I don't think a lot of people who don't have avoidant personality or haven't worked with individuals with avoidant personality, I don't think a lot of those people can really naturally or easily understand the degree of preoccupation that goes on here. And that's really what is really one of the most important things to take away, the degree of preoccupation around these issues. One of the things that makes the experience of avoidant personalities difficult is that these feelings are also often related to really strong negative beliefs. That it's not just a passing thought, so and so will reject me, or I should never get involved with that person. I should never say this because that would result in all kinds of humiliation. That's not just a mere thought. These are entrenched beliefs that this individual carries with them, that they operate from. Deeply entrenched beliefs, a whole belief system around the lack of safety and true trust one should feel when they are in proximity with other people. Now, how does someone with avoidant personality often cope with all this preoccupation? Imagine carrying this intensity. Imagine carrying this cognitive load around, this mental load. This is a lot to carry. A lot of times people with avoidant personality will talk about just how heavy this feels, how intense it feels. And so, one of the main ways that a lot of people with avoidant personality cope is to isolate, because they tell themselves, when I'm isolated, I feel safer. I don't have all this constant pressure and stimuli around me of other people and how other people might act, what they may say, what other people might think about what I do or what I say. I've heard many people say, oh, don't worry about what other people think. Or I've even heard people say, when I turned 40 or when I turned 50, I stopped caring about what other people think. People with avoidant personality, they don't have that luxury. It's not just something that goes away magically. It can improve. Individuals with avoidant personality can often get mental health treatment, can often get therapy, and sometimes individuals with avoidant personality also find that talking to their physician or a psychiatrist and medication can help. So there are things that can help. Now, if you are in a relationship with an individual who has avoidant personality, one of the things that you can do is you can ask if they would be willing to go with you to talk to a mental health professional so that the three of you can kind of talk and figure out better ways to connect, better ways to communicate, better ways to try to understand each other. I do want to reassure everyone that help is available and that help really is something that everyone can seek. I'll put a note in the description of this video with a resource that people can check out to look for services, a whole range of services that could be really helpful. But I wish you all the best.